Hello, hello, everyone. We're just waiting for people to join us. We'll give them about 2 minutes and then we can start. For those of you that are joining us, we were waiting just a little bit on anybody else. We have a couple of other people. They're probably going to join late, but I'll probably just go ahead and get started just because it is 30 minutes is pretty quick. So I don't want you all that joined in on time to miss out on this. Oh, we got another one. Perfect. So thank you so much, everyone, for joining us today, especially on, for at least for our end, it's a rainy Wednesday. My name is Jen. I'm the Business Development Manager here at Magnus, and I'm joined by Matthew, our colleague. He is Strategic Partnership Manager here at Magnus as well, and a former recruitment lead. So we actually work with a lot of healthcare professionals across Canada, just to help them, land really great opportunities, as well as answering any questions and just helping out a lot of our local Canadian communities as well. So, like I mentioned earlier, our time today is very, very, very quick and short, just because we wanted to keep this very high level for everyone. So it's going to be as practical as possible. We'll walk you through some basics on contracting, spend some time on some of the questions that everybody submitted beforehand, and then at the end, we'll leave some time for any live questions that you want answered. And for those of you joining right now, we will be recording the session, so don't worry, you haven't missed anything important. It was more of an intro. Um, and you'll have that recording. You can have it and look at it back on it, as well as share it with anybody that you think might benefit from it. And if your questions don't get answered, please just know that you'll have our contact information. Don't be shy, reach out to us. We're here for that to answer your questions. So what we'll do right now is, I guess I want to ask everybody on the chat that is here, if you're comfortable, let us know what your current role is. If you're a nurse, a PSW, you can type it in if you feel free to do that. And then if you're new to contracting, or if you're just kind of a veteran looking for some more connections and opportunities. I do know from the sign up, there was quite a bit of a diverse, um, just a diverse roster of people. Oh, yep, we got a lot of LPNs, RNs, PSWs. Yep, ultrasound too, which is really interesting to see. I think we have a sonographer in here, so if you're there, hello. Thank you, Ash. So, okay, just to recap what I just mentioned, this webinar in general is about answering your questions if you're curious about working with an agency, and how contracting works in the healthcare space here in Canada. So whether you're a PSW, whether you're a sonographer, whether you're an LPN, it doesn't matter. There is a spot for you. Again, we're covering big picture, high level questions here today. But by the end, what you should have from this webinar is you'll have a very clear understanding of what agency and contract work looks like here in Canada right now, the basic steps to get started, and what expectations to have. So I'm going to start with the basics, and we're going to go back and forth between Matt, who is lovely enough to spend some of his time with us here today. So, Matt, can you tell us what it actually means to work as a travel contractor at an agency?
Absolutely. And thank you for the very warm introduction. Happy to be here today. In short, travel work specifically means utilizing your education, your certification, and your workplace experience to help organizations that do not have the resources to support themselves. Just honing in on the travel component, most times, 99.9% of the time, means relocating to a more remote community, whether that be somewhere up north in the province you live in or in another province altogether.
So it sounds like this is a very specific job, I think, for a particular person. But in order to even make a decision whether to do travel nursing or not, do you think that you can kind of go over what some of the pros and cons are? That was actually one of the questions that we did get as well.
Mhm. Yeah, absolutely. So the number one pro, and you see it in the news, you see it on the floor, you see it talking to your neighbors, is the money. When you do work a travel assignment, you are paid considerably more than the permanent employees in a given community. As well as something not spoken about as much would be the ability to control your work schedule. So I know personally, I am envious of teachers who get summers off after working a very long school year. As a travel contractor, you're able to dictate what months you work and even the type of shifts you work. Being able to go in and say, I'm only taking contracts that work night shifts. I only want to work in facilities that will accommodate my work schedule of Monday to Friday. Those are negotiation tactics that you could bring in as a travel contractor. Another aspect that you're not going to really see kind of looking at social media would be diversifying your work experience. When you do work in major city hubs, you're usually siloed into working very specific roles, whether that be because of the certification you have, or because that's usually the need and how hospitals or long-term care homes are orchestrated in big cities like Toronto, Vancouver, Calgary. As a travel contractor, you do have the ability to kind of open yourself up to opportunities you just might be interested in. Maybe you are tired of working in hospitals and you want to try working in the private sector, working at a clinic. Maybe you're a long-term care nurse who wants to try working at a hospital. This is a great entryway in order to diversify your experience in a way where you can test the waters. And then lastly, this is something that everybody's excited about is travel. So being able to see different parts of Canada, one, traveling at your own pace at the expense of somebody else is always, always exciting. And as somebody who loves traveling in Canada, it is a beautiful, beautiful country. Always, always recommend traveling to the East Coast, the West Coast, even up north. There's
Mhm.
so many beautiful sights to see in our wonderful country. So why pay out of your own pocket when you can have an organization pay that for you?
Yeah, 100%. I agree with that. And I think like it's not often talked about how I know currently we've been doing a lot of work in Yukon,
Mhm,
and I've heard that it's just very, once you get there, it's just a very different world
mhm,
completely. So
mhm,
there's a lot of exciting places to work, but it just sounds that for the right person that wants to explore Canada, wants to make more money, wants to get
mhm,
that diverse skill set and work in different
mhm,
places. Ultimately, I think that there's nothing more altruistic than
mhm,
helping, a community in need. Because at the end of the day, like you mentioned earlier, rural is and remote is where a lot of the job opportunities are today.
Mhm.
But when you go and do those contracts there, you're making an actual huge impact. Normally, what it means for these organizations, let's say a hospital in the Yukon, not having maybe that staff that they need, like a sonographer, an ultrasound person, it would mean a closure for them, for that department. So you are actually doing something very good to help that local community, that you wouldn't normally see at one of those major city hubs. So I guess my follow-up question to all of this is, are there any roles specifically that Magnus is currently looking for?
Absolutely. So, if you are a healthcare worker in any capacity, there's always an opportunity for you to work. Again, Jen touched upon it. There's so many communities in Canada that do not have the resources, just simply due to population size, to provide adequate care to their communities. So, whether you're a sonographer, ultrasound tech, or as you see always in the news, a nurse, there's always an area in Canada that could use your expertise to make a huge difference in that community.
Is there a specific province, or region right now that you know of that, there's more demand for travel
Mhm.
contractors?
All of them. So I know a lot of people want to go where the demand is. The demand is everywhere. So every province in Canada has a need of some sort. The question is, how much are you willing to utilize your services for in terms of payment and then comfortability? So just as a simple equation, the closer you are to a city hub in any given province, the less the pay rate is, but the higher the comfortability. There are some
Hmm.
staff members who are okay going in the middle of nowhere, fly in, fly out community, because they're there to work and make a huge difference to that community. And that is fantastic. And then there's other travel workers who want to be a little bit closer to a city center, have the ability to fly home maybe every weekend or every other weekend. And that's equally as fantastic. So it's really just dictating your comfortability level and then how much you want to be compensated for that given service.
Hmm. Okay, so I think something that I personally found when I started working with Magnus and going back to what, or just adding to what you mentioned, is the fact that because we have been in the business for a really long time, and because we have built a pretty strong network across Canada, there are, like you said, not just remote, but urban opportunities. So don't feel like this is just like a nursing agency. Like, we are a healthcare contracting agency at the end of the day. And we do have a lot of contract work happening right now, even in the allied health space, that's just growing in demand. So this is an area that has been growing. I do know that even from my own personal experiences. Um, so I want to just talk a little bit, Matt, if you don't mind, about maybe what are the steps, to just applying or getting started, with contract work. So I'll talk a little bit about that, and then maybe I'll ask you a couple of other questions after I'm done, if that's okay.
Yeah, no,
So,
absolutely.
okay, so if for those of you kind of wondering, okay, how do I get this journey started? I have been interested for a while, or even right now, it's kind of piquing your interest. The first step, is talk to a recruiter. I know that might not be what you want to hear, especially because, um, just it can feel a little bit daunting to have that start that conversation. But I can tell you that there is an opportunity for you. We have a lot of things happening right now, and the roles that you see online are usually just a small percentage of what actual opportunities, that are out there. So I would just really encourage you to talk to a recruiter. They're going to answer your questions. They're going to customize an opportunity for you. That's what they're there for, to help you, and they're on your side ultimately. So the second step is to make sure that you confirm your licenses and where you can work. So, have your certifications ready, have your registration, all of that needs to be in good standing in the home province or the province that you want to work in. Um, the second thing is resume. I honestly, I know it's daunting to get, that resume updated, but it is so, 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 so important. not only for the recruiters, not only for you to get the right opportunities, but to just be able to also outline some of the work that you've done. Because a lot of these experiences, they'll need like cross skills of maybe you worked a little bit of ER, maybe you worked this, like there's just so many different ways to shape that. And again, talking to a recruiter, they can help you with that. The other thing is get your TB and your vulnerable sector check, updated as well. There's a lot of times that I've personally seen where that's been kind of a blocker or lead